Good evening. This is an exam preparation session. Shall we start?
Yes, ma'am.
Okay, so I'll discuss questions. Here, this is the first question. You can just read the question. So question here is a 40-year-old woman present to the clinic with the cramping abdominal pain. There is a typing error. It's abdominal pain that comes and goes every 5 to 10 minutes. And please read rest of the thing from the box. She's unable to pass gas or stool. The abdomen appears greatly distended. On auscultation, bowel sounds are quiet and hypoactive. I'm so sorry. There is many typing errors. On percussion, there is a resonance on palpation, and the abdomen is tender without guarding. Rectal examination is, and the rectum found to be empty. And the question here is, which of the following health problem would be most likely? So the age of the patient is 40 years and she has problem with abdominal cramping, which comes and go, which is very frequently coming and going. And she pass gas or stool, a sign of an obstruct. Abdomen appears greatly distended, the sign of obstruction. On auscultation, the bowel sounds are quiet and hypoactive. That is, there is reduced peristalsis, and abdomen is tender without guarding. Rectal examination, digital examination is done, but it found to be empty. The rectum is found to be empty. Okay. So here are the question. What could be the problem of the patient? Please drop your answers in the chat box. Option 1 is diverticulitis, second one is obstruction, appendicitis, and Crohn's disease. What is the answer? I request all of you to drop your answers in the chat box so that I can understand. Okay, so everyone selected the correct answer. Very, very good. This is intestinal obstructions. Perfectly good. And when you attend exam preparation sessions, you have to write the keywords. Here the keywords that you need to remember is what is a sign of intestinal obstruction. Okay. So in intestinal obstruction, rectal examination on that, the rectum will be found as empty and bowel sound will be quite low and abdomen will be distended and there will be abdominal cramping. Okay. And what is diverticulitis? What is diverticulitis? Yes, anyone? Diverticulitis is inflammation of the diverticula. Okay, what is diverticulitis? It is inflammation of diverticula. What is diverticula?
Pouch formation.
Yeah, it is. Parna.
A pouch formation, like.
It is a pouch, yeah, found in where? Outpouching ആണ്. ഈ outpouching of where? എവിടെയുള്ളതാണോ? ഏത് outpouching ആണോ?
Intestine.
It is a small pouches found on intestine. Large intestine ചെറിയ ചെറിയ pouchനെയാണ് diverticula എന്ന് പറയുന്നത്. So it will be like this. You have to accept my picture. Not very good. എന്നാലും കുഴപ്പമില്ല. So this particular outpouching, ഇതിനെയാണ് diverticular എന്ന് പറയുന്നത്. So diverticulitis is inflammation of this. Okay, basically this is found where? In the large intestine. Okay, so inflammation of this can be indicative, or when diverticular get infected, then it is considered as diverticulitis. Okay. What is appendicitis?
Of the appendix.
Inflammation.
Inflammation of the appendix. This is appendix. Okay. Appendix is attached to the ileocecal wall. So inflammation of appendix is considered as appendicitis. Okay. What is Crohn's disease?
This
Inflammation of lining digestive tract.
It can be an inflammation of anywhere in the digestive tract, but basically when we learn the incidence, it will be commonly found in the descending colon, descending small intestine, ileum. Okay, so here Crohn's disease is the inflammation of ileum. If there is inflammation in the colon, it's considered as ulcerative colitis. Ulcerative colitis and Crohn's disease, these two comes under inflammatory bowel disorder. Crohn's disease, ulcerative colitis, inflammatory bowel disorder ന്റെ ഒരു sign ആണ്. Clear? So it's clear. Next question. If anyone want me to explain again, definitely you can ask me so that I will. A patient has an order for 1000 ml of intravenous fluid to infuse over 8 hours. And the available IV tubing has a drop rate of 10. Which of the following rate is correct? (1000 ml over 8 hours. And the drop factor, it is 10. And what is the formula? Total volume to be infused into drop factor divided by time in minutes. Yeah.
21 drops per minute.
അപ്പൊ ഇവിടെ എത്രയാ? ഇവിടെ സോറി. അപ്പൊ ഇവിടുത്തെ ടോട്ടൽ വോള്യൂം എത്രയാ? 1000 അല്ലേ? 1000 into drop factor 10 divided by time in minutes എന്ന് പറയുമ്പോൾ 8 into 8 into 60. Okay. അപ്പൊ എത്ര ആൻസർ വരും?
20.83.
So the answer could be 21 drops per minute. Yes. So the answer is, yeah, C, 21 drops per minute. Okay. Next question. A child is admitted to the pediatric ward. What is the most likely diagnosis? Appendicitis, iron deficiency anemia, acute lymphocytic leukemia, hepatitis. And here the problem of the patient assessment findings include fever, lethargy, joint pain, abdominal pain for several weeks, and the patient has history of recurrent respiratory and ear infection. Physical findings include widespread ecchymosis, generally lymphadenopathy, hepatosplenomegaly, and pallor. Fine. And here the lab work shows low hemoglobin, low RBS count, and low hematocrit and low platelet. So I repeat, a pediatric child is admitted, and on assessment, there is fever, lethargy, joint pain, abdominal pain, and the patient has already had a respiratory and ear infection, and widespread ecchymosis has noticed, and lymphadenopathy, hepatosplenomegaly, and there is pallor. The patient looks pale, and on lab results, when we did the lab results, hemoglobin level is low, RBC count is low, and hematocrit is low, and the platelet is low. What could be the supporting diagnosis?
Lymphocytic leukemia.
You all can drop your answer in the chat box. So the answer is acute lymphocytic leukemia. Perfect. So the answer for this is acute lymphocytic leukemia. Acute lymphocytic leukemia is a kind of a blood cancer. There are 4 kinds of leukemia: acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myelocytic leukemia, and chronic myelocytic leukemia. Okay. So acute lymphocytic leukemia is the common kind of a leukemia. Okay, so which is very common kind of leukemia, basically found in pediatric or in children. Fine. So what is leukemia? It is blood cancer. What happens here? WBC get excessively proliferated. Okay, so excessive WBC get proliferated. That means WBC ഒരുപാട് proliferate ചെയ്യും, abnormal ആയിട്ട് വളരും. Okay, so അതാണ് leukemia basically സംഭവിക്കുന്നത്. So ultimately this is going to affect the bone marrow. Okay, so yes. Here is the next question. 65-year-old woman was diagnosed with hypothyroidism at the age of 45 and is brought to the clinic by ambulance. Okay, and on arrival, what are the findings? Physical examination finding is mentioned in the box, a round box, and then in the triangle, vital parameters. Fine. So on arrival, the physical examination finding is she had severely and decreased level of consciousness. Her breathing is shallow and irregular, and she is cool and dry and pale. There is generalized non-pitting edema in all extremities and the face. BP is low and heart rate is also low in the lower limit, and respiratory rate is okay and temperature is low. Fine. So she is 65-year-old hypothyroidism patient, and the hypothyroidism was diagnosed 20 years ago. Fine. And she was brought into the hospital through an ambulance. So this is something, an emergency situation. Okay. So on arrival, she was literally cool and her breathing was irregular, and she had edema on the face and extremities. And the question here is, what is the most appropriate method to rewarm the patient? So here, ultimately, hypothyroidism will cause extreme hypothermia. It is considered as a mixed edema coma. So this is a situation where she is experiencing mixed edema coma. It is a complication of hypothyroidism. Okay, this is literally considering as a life-threatened problem. So the better management for this is like rewarming the patient. So the question is, how do we rewarm the patient? You can drop your answers, please. So this is the time for explanation. Majority, everyone have selected answer 1, but 2 of you have selected D. Cover the patient with a hospital blanket. Already I said this is an emergency situations where you have to act very quickly and it has to be in an effective manner. Fine, the patient should not move into hypothermic shock. So you have to give a warmed intravenous isotonic fluid. Okay, so warm saline can be given for the patient. Definitely, yes, D will also help, but the effect will be much lesser. Clear ആവുണ്ടോ? ബ്ലാങ്കറ്റ് യൂസ് ചെയ്തിട്ട് കവർ ചെയ്ത് കഴിയുമ്പോൾ പേഷ്യൻറ്റിന് ഉണ്ടാവുന്ന ഇഫക്റ്റ് വളരെ കുറവായിരിക്കും വാം IV ഫ്ലൂയിഡ്സ് കൊടുത്തിട്ടുണ്ടാവുന്നതിനേക്കാളും. Okay, so the better answer will be A. Okay, so D is also correct, but it is not the management of myxedema coma. It can be, you can use this particular fourth management in case of hypothyroidism. Clear? So please remember that. Is that clear? I think Jane and Rahmat selected these 2 answers. Yes, rest everyone have selected the correct answer. Yes, Anjali, place the patient in a warm bath. Anjali, your patient conscious decreased level of consciousness a patient in a warm bath. B and C is completely wrong. Manslayo. Patient in a situation or okay, fine. Yes. And here is the next question. A nurse on the oncology unit is planning care for several children who are terminally ill. Which of the following should be included in the plan of care of the child who practices catalysis? Fine. So here you are working in an oncology unit where there are many children. Out of that, one child is terminally ill. That means metastasized patient. Okay. So, and the life expectancy is much lesser. So while taking care of this particular child, which of the following should be included in the plan of care? As per the cultural belief, this is a question which is usually asked from a cultural practices, and this particular child practices Catholicism. Notifying the crematory, it's like cemetery. You have to just inform the child that what is cemetery and which cemetery usually we use after death. See, I don't feel like it is really necessary. And discussing a reincarnation, it's like a rebirth, and closing the eyes as a death approach, and offering the sacrament of the sick. As per the Catholicism, as per the belief of Catholicism, when we take care of any terminally ill patient, usually we give a sacrament of sick. Okay. Andigudasha nu parayum. Fine. Okay, fine. Next year, a 4-year-old girl was playing outside. She came to her mom and crying and holding her right upper arm. She went to the hospital with the swelling over the upper arm, pain and itching. What is the most appropriate management? So this particular girl, her age is 4. She was playing outside, and what she has now problem, she's crying, and she was just holding her upper arm and swelling over the upper arm, pain and itching. That can be a sign of anaphylaxis. Okay, so always remember, when a child who is playing outside, it can be so when the child is playing outside and when the child get any kind of the symptoms, you can just imagine this can be, I'm not saying that it should be, it can be, and the signs of anaphylaxis. So what are the signs of anaphylaxis? Anaphylaxis can be expected as a result of any kind of food, but this is a child who was playing, so it can be some bite of an insect, or it can be some exposure to an chemical thing, or smoking something, unwanted thing, where the child was playing on the ground, or in front of the house when they are playing, and in front of the house there is a heavy road or a heavy traffic road. So definitely, yes, chemical exposure can be expected. Fine. So anaphylaxis can be expected for children due to consuming some kind of an allergic food or wearing some kind of dress and getting exposure with some kind of allergens, or it can be some bite of any kind of insects. And the signs of anaphylaxis will be vomiting, behavioral changes, redness over the body, flushing, angioedema, thus whealed out lesions or puffiness. Because of angioedema, there will be periorbital edema and lip will also just bulge out. Fine. And cough and wheeze and stridor, hypotension and tachycardia. So I request all of you to by heart the signs of anaphylaxis. Okay. Situation for anaphylaxis and the sign of anaphylaxis. What makes the patient to end in a anaphylaxis, or what all are the signs of anaphylaxis? And very important management, how do we take care when you suspect anaphylaxis in children? Okay. Option 1, maintain patent airway. Very good. And observe after 30 minutes. It's not the priority, because definitely, yes, maintaining patent airway is very good. But observing, simply waiting for 30 minutes is not really safe. And IM epinephrine, yes, it can be the choice of treatment. Prepare for intubation since the patient is not unconscious. It doesn't require, so C can be removed. And administer atropine sulfate is not the choice of treatment. So what can be the answer?
B.
Second one. So what is the first choice of management for anaphylaxis? Repeat after me. What is the first choice of treatment for anaphylaxis? Is IM or sub-Q epinephrine. Okay. What is the risk factors for or the causes for anaphylaxis? It can be certain kind of food, dress, chemical, or it can be insects, bite of insects, wasp injury. Okay. എന്തെങ്കിലുമൊക്കെ ഇൻസെക്ട് കടന്നല് തേനീച്ച അങ്ങനത്തെ സാധനങ്ങളൊക്കെ ഉണ്ടല്ലോ, അതിന്റെ എന്തിൻ്റെങ്കിലും ചെറിയ small insects, when the insects bite the baby, definitely anaphylaxis can happen. Fine. Here. Okay. And what could be the sign? There will be behavioral changes. If this particular child will be very small, then behavioral changes cannot be really identified by you all. But definitely, yes, it can be. And cough and wheezing and stridor will be expected for everyone. And please remember why cough and wheeze and stridor is expected. It's because of laryngospasm. Okay, so cough, wheeze, and stridor is because of laryngospasm. So all allergic reaction can cause laryngospasm. Okay. Can anyone tell me the one respiratory condition which can be because of an allergy where there is a respiratory spasm happens? I repeat, there is one condition. It's a respiratory condition. It's because of an allergy. As a result of allergy, the entire respiratory tract become obstructed, or spasm of respiratory tract will happen. What is that?
Asthma.
Yeah, it's asthma. Yeah. Okay, fine. Next here, the question is 60-year-old woman present to the emergency department in the triage unit. On assessment, the patient had labored breathing. She appears anxious, sweating profusely across the forehead, and the symptoms had begun suddenly 1 hour before, and her jugular vein appeared distended. And she has productive cough, auscultation, and respirations were wet, sorry, there is a wet respiration and it's not clearing with coughing. Okay, so the patient has labored breathing. She is anxious, sweating excessively, and it was just started 1 hour ago. And jugular vein like appears distended, and she has productive cough, but the respiration is wet, but it's not, anything is not coming out. Okay, so it can be a dry kind of cough, no expectoration. And which nursing diagnosis is most appropriate? So that is the question here. Okay, so nursing diagnosis, ineffective breathing pattern and ineffective airway clearance and impaired gas exchange and pain in the chest. So please drop your answers. Okay, so you have selected impaired gas exchange and Bhavya selected ineffective airway clearance and Sriji, pain in the chest. Did the patient complain pain in the chest? Would a chest pain complaint ചെയ്തിട്ടുണ്ടോ? Did the patient complain chest pain? ഉണ്ടോ?
ഇല്ല.
ഇല്ല. അപ്പൊ പിന്നെ നമുക്ക് ആകെ കളയാൻ പറ്റുന്ന ആൻസർ ഏതാ? Pain in the chest is a wrong answer, right? Okay. So ഇതെന്തായിരിക്കും ഇൻഡിക്കേറ്റ് ചെയ്യണേ? If it is an ineffective airway clearance, B ആണ് ആൻസർ എങ്കിൽ the airway will be completely filled with thick secretions and the patient is not able to remove the secretions and it is causing wheezing. All those kind of signs should be there. But here, while coughing, nothing is coming out. Fine. And there is no wheezing and there is no, what is that called? Inflammatory problems. Okay, so ineffective airway clearance, I don't feel it is really apt to with this. Impaired gas exchange can be pain in the chest, definitely no. Ineffective breathing pattern, yes, that also. So either ineffective breathing pattern or impaired gas exchange. So ഇതിനകത്ത് ഇവിടെ എന്തെടുക്കാം? Yes. It can be indicating ineffective breathing pattern. Okay, so it already the patient altered or labored breathing under so labored breathing and profuse sweating, it can be because of hypoxia. Clear? And jugular vein appears distended. Yes, that can be something related with a cardiac problem. Okay, so here the basic problem which is related with the breathing issues. So the better answer for this is ineffective breathing pattern. Okay.